Hey guys, what's up? It has been a minute. Gosh, it's been about a month since I've checked in with you all, and I really apologize. I have been trying to get better about doing these vlogs and about doing more hand therapy videos and stuff like that, but studying has completely consumed my entire life recently, and so things have been really super crazy. So I do apologize. I announced in my last video that I decided to take the CHT exam, or the Certified Hand Therapy exam, in November this year, and so things have just gotten a little bit crazy. We're down to the wire now, 4 weeks out. Whew. I am really happy, but also really terrified at the same time, because I only have 4 weeks that I have to work super hard for that are left, but I only have 4 weeks until the test, so I'm a little bit freaked out. But anyway, I just got home from work. I got my cold brew coffee with me. We're feeling good, feeling pumped. Doing a little bit of a vlog before I hit the books today, so I just thought it would be fun to sit down and talk to you guys about where I'm at, how I'm feeling 4 weeks out from the CHT exam, what my studying processes have been like, and all of that good stuff. So that's where we're going today, and I promise, pinky promise, that I'm going to make more videos, more hand therapy videos, the content that is probably more interesting for everybody to see and kind of actually helpful for you in learning about hand therapy and different diagnoses and treatment and stuff like that. I promise you, with this pinky, that I will start making these videos more consistently after this test is over. That is my promise. And yeah. Oh, it's going to be an interesting video today. I'm in a mood. Okay, so 4 weeks ago, I announced to YouTube that I was going to be taking the test. I planned originally not to tell anyone other than just like a couple people. Somehow word got out. I don't know. I told like a few people, and then I told YouTube, and pretty much everybody knows. So no pressure there. No, it's been good. A lot of people have been very supportive of me, and I've just been super grateful for that support, and that just people listening to me complain about studying and being there to encourage me and cheer me on and tell me everything's going to be okay. And even either way, however it goes, win, lose or draw, pass or fail, everything's going to be okay. So that's been really awesome. My coworkers have been amazing with their support. One coworker in general, who I consider to be my mentor, lent me her 4th edition purple book, which is so freaking amazing. Like, I've been using the 3rd edition because that's what I stupidly bought like 3 months before they came out with this 4th edition, and it's an expensive book, okay? I didn't want to buy the 2nd version too, or the 4th version. Wow. 4th version too. So my coworker lent this to me. She's on vacation right now, and so I've been going through that and trying to get through it before she comes back, or before the test is over. I'm still working my way through my purple book, and it's been amazingly helpful. She also lent me some of her old notes and stuff like that she felt like was important, or things that she had a hard time remembering. So that's been amazing. I'm just trying to kind of absorb everything that I can. Other coworkers, my family, my friends have just been super supportive of me, and just kind of, keeping me level-headed and calm, and in a time where I feel like everything is chaos and just stress, I am feeling really supported and loved. So that's been really awesome. Yeah, we're 4 weeks out. This is insane. My schedule of studying has kind of shifted too. So before, I was trying to get in like maybe half an hour to an hour every day, taking a couple days off a week. And now that we are 4 weeks out, there are no more days off. I am doing little bits whenever I have time. At work, I'm studying. If I have time between a patient, or if I have a cancellation, or even on breaks or things like that, I'm just cramming in as much as I can. When I get home, I try to kind of relax for a few minutes. And then I do at least an hour to an hour and a half, sometimes 2 hours a night. And the weekends, I'm trying to get in 3, 4, 5 hours, Saturdays and Sundays. So I'm studying really, really super hard. And of course, not every minute of that is being productive, but I'm reviewing, I'm learning new material, I'm reading chapters, I'm expanding my knowledge, I'm going through multiple choice questions, my Quizlet, my anatomy review, just trying to practice these things over and over and over again until I get them down and really truly understand the concepts. I have changed my social structure and my other responsibilities. So I actually stupidly decided to go on vacation last week, and I decided that before I decided to take the test, right? So I planned this vacation, and then I decided to take the test in November. And I was kind of regretting it because I knew I had to take my books with me. I couldn't take a full week off without studying this close to the exam. But honestly, it refreshed me a lot, and I felt really motivated to jump back in when I got back this last weekend. So, I mean, I did definitely study on my vacation. I didn't spend a ton of time. I spent like maybe 3 to 4 hours studying on vacation, but it really refreshed me. And I felt when I came back that I had a lot of motivation to push these last 4 weeks and not be so burned out. Because honestly, guys, I was pretty burned out before I went on vacation. I was starting to have like nightmares and just be super tired all the time, just exhausted. I felt really stressed and like unhappy, and yeah, it's not a healthy structure to follow for a long period of time, but this is life, right? Like we go through these times where we're asked to do more, or we require more of ourselves. So that's kind of where I'm at. I'm also very spacey. I'm sorry. This is probably the worst video ever, but that's okay. It's gonna get better, guys. I promise. Yeah. But anyway, yeah, I kind of got off on a tangent there. But anyway, the last 4 weeks, this prep time, I've decided that I'm going to try to go to the gym 2 to 3 days a week, instead of my usual 4 to 5. Like, I just can't commit the time to that right now, and I can't do both well. So for right now, just on maintenance mode with my maintenance mode with my fitness routine. I'm not doing any like crazy dieting or anything like that, or following my macros the way that I normally would. So yeah, I can't do both well. So I'm just focusing all on my test and not stressing about other things that can be put on the back burner for right now. I am primarily going through the Purple book at this time, both the 4th edition, which my coworker lends me, and also the 3rd edition, which I own. In my copy of the book, the 3rd edition, I'm starting to kind of highlight as I go, and like certain questions, if I know I'm going to have a hard time remembering them, or if it's a concept that I want to look back at, I'm highlighting it. I'm also taking notes as I go through, so I'm just kind of making a list of certain questions, or like there are some questions that are just hard to remember because it's like numbers. Like it'll be like, I don't know, the percentage of the population that the FDS tendon of the pinky is absent in, like just arbitrary things that are going to be hard to remember and that I know I'm going to have a hard time remembering. And what I'm going to kind of do as I go through and make all these lists or these notes of little things that I want to review, I'm going to kind of organize them. I'm not going to spend a ton of time doing this, okay? But I want to organize it in a way that's logical and makes sense to my brain. Right now, they're all just very disorganized, little jot down notes every time I get to a question that I don't know or that I, want to kind of look up more or review. And I think that will be really helpful the night before the test and the day of the test, because I'm not going to do a ton of studying. I don't think I'm going to do a ton of studying the night before or the day of. But when I get there the day of, I'm going to try and get there really early and sit in my car in the parking lot until they open and kind of look through my notes. And just, not that I'm necessarily even studying, but just having that visual memory in that moment is going to make me feel really confident. And so it's probably not even a useful thing in terms of studying, but it's going to make me feel better about taking this test. So I'm doing that, and as I go, if there's a chapter in the Purple Book that I don't know much about, like I don't have much experience working with burns or tissue grafts or even amputations, prosthetics. I don't get a lot of people that use prosthetics, so I needed to read the Rehab of the Hand chapter about that so that I knew how to answer the questions. So I'm doing that. I'm trying to kind of review and go through the Purple Book a couple times. My goal for the next 4 weeks is to get through it 2 to 3 times total. Probably 2. 3 is just ridiculous. That's probably not going to happen. And just trying to kind of hit those multiple choice questions and review everything that I need to. Continue to review my anatomy anytime I have time. Continue to review all of the neurological pathways and all those things that are a little bit harder for me and that I know I have a difficult time with. Reviewing all of my diagnostic testing and all that kind of stuff that I get confused easily, and just really solidifying the content. I also am planning to possibly purchase one of the practice exams from Exploring Hand Therapy, which is a good clinical resource. They have a lot of continuing education on that website. But I think not even necessarily to like practice the exam questions, but just to practice the test taking experience. I think that will be really helpful too, because honestly, this test is 4 hours and it's 200 multiple choice questions. And I'm not a bad test taker by any means, but I do get test anxiety, and this is such a high pressure exam that I'm a little bit concerned about panicking in the test. Like, I'm afraid that I'm going to hit a question that I don't know the answer or that I'm not confident in, and that's going to shake my confidence and that's going to mess me up. And I want to be really confident, and I want to kind of practice my test taking skills, because it's been a while since I've taken like a standardized test too. The NBCOT for me was over 3 years ago. So it's been a while, and I want to practice that test taking skill just as much as I'm practicing more, knowledge-based questions too. But it's also different taking a test on a computer, which is how the HTCC has this exam, right? The hand therapy exam is on a computer, and the Purple Book is a book. Like, it's just different. So I want to practice that and make sure that I feel prepared and confident, and that I'm not going to get test anxiety and kind of throw myself off that way. So that's kind of my plan too. I was thinking I might not do that, but I think I probably will, because even though I've already spent a ton of money on this exam and preparing for this exam, the study resources, all that kind of stuff, even coursework and education and stuff like that, I think it might be worth it just to make myself more confident. So I don't know if you agree or not. If anybody out there is a CHT and they've taken the exam and they've done, practice tests or anything that you've used in the past that you felt like was helpful, comment below. Help a sister out. Whatever suggestions you have is helpful to me at this point. So this has been pretty much probably the most disorganized, most rambly, crazy, babbling video ever made on YouTube. My mind is very disorganized right now. Things are just crazy, and crazy in a good way, but just crazy. Definitely excited to get this exam over with and get back on with normal life. This is just not a sustainable pattern for a very long time. It's just not sustainable. But it's been really good too. I don't mean to say it in a negative way. It's just been very, very challenging and very difficult, and I have pushed myself harder than I ever have in my life. I have worked harder than I ever have in my life, And I've always been a very studious person and very academic, but man, this is just a total difference than anything else I've ever gone through. And I can at least be proud of the fact of how hard I've worked. Whatever happens, win, lose, or draw, I can be proud of myself for knowing that I've worked so hard and I have put in the time. I have been committed to this. I have been dedicated. I have lived, breathed, and slept it. I've had literal nightmares about the test, and about just crazy things in general. All the time I'm working with my patients, I'm thinking about test material. I'm stretching them into a certain position and I'm thinking about what that position is doing and how it's affecting the body. It is interfering in the best way. Interfering sounds negative. With every aspect of my life, it is integrated with every aspect of my life. And I know that I am becoming a better hand therapist through this process, and I am so proud of that, of myself. And that's really been a hard thing to accept, but it's true. Like, I can honestly go into this test saying that I tried my very hardest, and I know with confidence that I have done my very best that I possibly can. I have done everything that I can, and I will continue to do that for the next 4 weeks up until this exam. So win, lose, or draw, it's going to be okay. At least I know I'm becoming a better hand therapist, and I truly feel that. I see it in my practice. I see it with my patients. They're improving more. I'm making smarter clinical judgment calls and clinical decisions, and I'm progressing them better. So I can see the way that it's affecting me in a positive light. So that's something. And it's really important. And this has just been a complete ramble fest, but thank you guys so much for watching. I really appreciate all of your support and for just even listening to me talk and babble for the last several minutes of your life.